The two-day international conference on early childhood development, with the theme, The Promise of Early Childhood Development, Investing in the Early Years, was held during September 25th and 26th, 2019, at the Allama Iqbal Open University, Islamabad. The conference was organized by a consortium of national stakeholders, including Pakistan Alliance for Early Childhood, Allama Iqbal Open University, Islamabad, Rupani Foundation, Pakistan, Sun Secretariat, Nutrition Section, the Ministry of Planning, Development and Reform, the Ministry of Federal Education and Professional Training, and the Karakoram International University, in collaboration with UNICEF, Open Society Foundations, UNESCO, the Aga Khan Foundation, Pakistan, the Association for Academic Quality, and other key partners and sponsors. The conference featured an open session, plenaries with 10 international speakers, 8 face-to-face and 2 online presentations, and a closing session. It also featured 13 well-attended parallel sessions, a workshop on fostering language skills in early childhood settings, a roundtable discussion, and poster presentation on key topics. The conference brought together over 580 participants, including legislators and policymakers responsible for health, nutrition, child protection, education, and social welfare, ECD experts from national and international bodies, practitioners, researchers, donors, academicians, and parent representatives deliberated and shared their ideas on the theme and sub-themes of the conference to evolve an integrated, multi-sector approach and how to operationalize it to promote holistic ECD in the country from conception to 8 years. The inaugural session of the conference was addressed by the Vice-Chancellor, AIOU, Professor Dr. Ziaul Qayyum, Mr. Nasruddin Rupani, Chairman Rupani Foundation, Mr. Muhammad Azam Khan Swati, Federal Minister for Parliamentary Affairs, and Ms. Ada Girma, the country representative of UNICEF, besides educationists, researchers, and practitioners in the field of ECD from across the country and abroad.
This is the third conference, which I mentioned the other day as well, that we have rephrased it. It used to be early childcare education in the beginning, but this year we have rephrased it, renamed it as early childcare development, which basically gives a more holistic view of this whole phase of childcare development, childcare education, to include health, nutrition, and other well-being aspects of child between the age of 0 and 3.
There is a general misconception about ECD. We think that ECD is limited only to a child's development, whereas it is the development and nurturing of the whole family, which leads to the development of healthy, productive citizens. Rupani Foundation is working hard to address this misconception through involving parents, extended families members, communities, leaders, policymakers. The foundation has been working from 0 to 8 for the last 12 years. But now we are going to focus on -1. Last first conference, I presented to all the participants and stakeholders -1. -1 means pre-conceiving. And this year, I would like to propose and request all the stakeholders to think on -2, because I believe -2 is also very important, and it starts at adolescence health. If the mother is not healthy, she will not produce a healthy child.
3 years back, when we met in the first conference, we made 4 promises. One promise was that this event is going to be a regular annual event, and I'm very happy that this is the third national conference, international conference on ECD. The second promise was that we should take out a research journal in ECD. I'm very happy that AIOU is taking out a research journal in ECD. The third promise was that we should be offering short courses in ECD. I'm so glad that Department of Education, Department of Education is already offering short courses in this area. The fourth promise was that we'll be setting up a center of ECD, and I think, as far as I know, all the statutory bodies have approved that center, and that center is going to be the first national center in ECD.
I'm grateful for all those NGOs, UNICEF, JICA, WHO, and many others, along with Rupani Foundation and Khan, that you have come together and providing us the roadmap as to how we can build a block, put a foundation on which this great social sector of humanity is going to grow, to provide an environment where from the inceptions to 8 years or 3 year or 4 year, I don't think there is any substitute to this great cause.
We know from research that approximately 15% and 20% of women in low and middle income countries are at risk of antenatal and postpartum depression respectively. In the last 12 years, The Lancet has published 3 high-level reviews on the global state of children's early development. In the first series, published in 2007, we were made aware of the global challenge of the high numbers of children unable to meet their developmental potential due to both biological risks such as malnutrition and psychosocial risks such as inadequate early learning opportunities and maternal depression. In the second series in 2011, we had good evidence from the neurosciences about the importance of early intervention investment, including those first 1,000 days of life. We also had growing evidence from a large number of trials about what works to promote children's early development. And in the most recent series, published in 2016, we recognize that there has to be a life course approach in investing in early childhood development. And this approach is supported by multi-sectoral actions, and these actions require support from strong national policies.
Economic analysis from developed and developing countries. World concludes that investing in the early years yields some of the highest rates of return to families, societies, and countries. Poverty, malnutrition, poor sanitation, severe childhood diarrhea, iron deficiency, anemia, orphan status, substandard housing, domestic violence, harsh physical punishment, and maternal depression are common risk factors that put the children at risk of poor development.
UNICEF Pakistan has prioritized in its country program of cooperation for 2018 and 2022 a multi-sectoral strategic approach on early childhood development and is working closely with different government counterparts at both national and provincial levels to ensure that the rights of the youngest children in Pakistan are upheld. Aligned with its global call for action to governments and businesses, UNICEF strives to support the government to, number one, invest urgently in services that give young children, especially the most deprived, the best start in life. Number two, to expand access to effective early childhood development services in the homes, schools, communities, and health clinics, with particular attention to deprived communities. We have data in Pakistan, so we should be able to prioritize the most deprived communities as we roll out the ECD interventions. I think this is one great thing that Pakistan has. There is baseline, absolute, really very rich data, so we should be able to identify even by district the most deprived district and be able to really put the most deprived at the very top of this agenda.
WHO and UNICEF, supported by the Partnership for Maternal, Newborn and Child Health, the PMCNCH, the ECD Action Network and many other partners, has globally launched the Nurturing Care Framework for Early Childhood Development at the World Health Assembly in 2018. Nurturing, protecting and supporting babies from pregnancy to age 3 is essential to achieve the Sustainable Development Goals and help countries achieve their targets of every woman, every child, global strategy for women's, children, adults and health.
We at Foundation Open Society Institute in Pakistan are supporting local partners for early childhood development, and through them we are working very closely with the government. And the whole idea is to help the government to implementation of ECD, and particularly in this case, goal 4.2. Just very quickly, we are supporting the Pakistan Alliance for Early Childhood. Secondly, with the Children Global Network Pakistan, we have established Parwan. Parwan is the Center of Excellence on Early Childhood Development, and through Parwan, the courses are also being developed with Allama Iqbal Open University also. The course for students has been developed, and similarly with the other universities in the country.
ECD has been at the top of the agenda at the Karakoram International University and with the Faculty of Education, because somehow the GB is faced with the challenge of malnutrition and stunted growth. Unfortunately, when I look at the youth and the young, particularly the females in the hostels, I see most of them are underweight and under height, and that is the stunted growth. I just normally see that very few are more than 5 feet in height. So this is the biggest challenge for us in the Gilgit-Baltistan, that how can we bring the to curb this stunted growth or wasted growth phenomena. We are working with our partner of scaling up nutrition, a rigorous program by the Food and Agriculture Department of the Karakoram University, and we are working with them to bring some additional nutritions and supplements.
WHO coordinated development of this framework and facilitated a process whereby over 1,000 people from 111 countries contributed. The Nurturing Care Framework was launched at the time of 71 First World Health Assembly in 2018. It has been very well received by all the member states.
I want to just really pay tribute to the Pakistan Alliance for Early Childhood. It's wonderful seeing this alliance really alive. It's so important the way it brings people together. It's fantastic the way we're seeing government, NGOs, academia, international organizations. It's just so important to see these sorts of partnerships. And it's wonderful for me to be back in Pakistan. Intricate dance between genes and experience that we really understand a lot more about now. The way the different aspects of experience, that experience of nurturing care that we've been hearing about a lot, the physical environment, the nutrition, and that love for a child, they all come together to really sculpt brain architecture and create those neural pathways. Those experiences actually leave a chemical mark chemical signature that actually sort of sits on top of a gene and really influences whether it gets turned on or off and how that all happens. It's really powerful knowledge we're obtaining these days. And I think the thing we really understand now is how it's these neural pathways actually influence our whole lives, our learning, our physical and mental health, our behavior, and we've heard too about the intergenerational influences that are so important.
First of all, I think that we all owe a debt of gratitude to the Rupani Foundation for organizing this event and their commitment to early childhood education. This is really something which is so essential, and people like me who don't know much about it are discovering a great deal as in the last 6 months to a year. Frankly, there are elements in the early childhood education that I was completely unaware of. I must confess my ignorance on that score. For example, I have learnt to my surprise, and a pleasant surprise, that actually early childhood education can begin before the birth of a child. Now this came as a big surprise to me, I'll be honest with you. The Ministry of Education has started a plan to create a new national curriculum, and that's a very, very long and important exercise. And in this important exercise, we have included an entire portion on early childhood development, and we have tried to collect experts who will guide us and advise us on early childhood education. We must create an awareness about early childhood education, because a lot of the children who are not able to go to a formal early childhood education center because of a variety of reasons, at least if the mothers are aware that early childhood education is so important, they'll be able to do their part in trying to make the child aware of, or trying to educate the child before child goes to school actually. So that's our Constitution says, Article 25A says, the state is responsible for education between the age of 5 and 16. But there is no mention in that of early childhood. But then we will make sure that in our planning and in our, we are able to create a whole segment of early childhood education.
A universal service best serves social integration. Rather like integration of special needs in schools, it's far better if we bring everybody together and everybody rises in terms of their health, their well-being and their achievements. Engage with key players, local, national and international, NGOs and academia. You have them, you're doing it. Develop quantitative and qualitative sources of evidence on impact, but do leave space for lessons learned, gaps in policy and practice, and the challenge of different contexts. So, an integrated approach best serves multiple vulnerabilities, but we do need to keep in mind learning in the setting where you work or learning in context is the learning that has the best payoff, because it's customized to the situation, because it's social and it involves the group who you want most to work with. So such learning changes the individual and the context and the community simultaneously.
ECD was mentioned, an annual plan with focus on first 1,000 days window. Then the multi-sectoral nutrition action plan. This also has number of intervention proposed for ECD and the high-level ECD task force and technical working group. So this also plays an important role. Then the partnership, as mentioned, that UNICEF and number of other WHO, World Food Program, number of other INGOs, NGOs, they are willing, they have the expertise, they are available to support the ECD. So these are some important opportunities that we have.
Rehabilitation of young children and families is a common form of service delivery that is integrated within two primary service contexts. One is early intervention, targeting families of young children 0 to 3 years old. The other is early childhood special education, commonly referred to as therapeutic preschool or inclusive early childhood education environments that target families of young children 3 to 5 years. And the goal of rehabilitation, much like that of healthcare in the United States, is to achieve a balance of achieving high quality service delivery at the lowest cost possible while achieving the outcomes that are meaningful to target in those service provisions.
From James Heckman, who is a Nobel economist. And James Heckman says, like it or not, the most important mental and behavioral patterns, once established, are difficult to change once children enter school. What Heckman is saying is what Mr. Rupani said yesterday. He said, we cannot leave it till children get into school. It's too late by then. We have to start earlier. And we know that investment in early years has high returns later on to the economy. For $1 invested, American research has shown you get $7 back. You may say, but we are Pakistan, we are a poor country, we cannot afford to invest. I would say to you, you cannot afford not to invest. Why should we invest in early years? And I'm looking at the politicians here. If you want to get anything done, work with the people who've got the money. That's what we learned. Work with your politicians, knock on their doors, shout at them, lobby them, tell them how important it is. Work with your politicians.
We believe that for good education, we have to lay down the sound foundation for the learning of children and their overall physical and mental development. For this purpose, for the last 5 years, we have been investing on the supply side of providing proper infrastructure to the schools. With the support of the political government, we have attained with the bless of Almighty Allah. And during the next 5 years, we intend to incorporate the quality education in our system. And ECE is the beginning of our efforts for incorporating quality into our primary and elementary and secondary education.
So a child who is taken care of in the first 1,000 days is 10 times more likely to recover from life-threatening illnesses, from diseases, diarrheas, dehydrations, respiratory tract infections, pneumonias as was discussed yesterday. He is less likely to drop out of school. We are all afraid of children dropping out of schools. And in the dollar value, he earns more. And in the moral values, he leads a healthier life. And from the educationist point of view, the degree wala point of view, he has an average of 10 IQ points more than his peers.
I want to thank the Rupani Foundation and all the Alliance as Early Child Care Development who had organized all of this. There are over 1 million deaf children in Pakistan, yet less than 5% of them have access to education. Keep in mind that where schools are available, these are mainly in the urban areas, but 75% of people live in the rural areas. The government schools that exist in the rural areas only go up to 8th grade, and even then the quality of learning are minimal, limited I mean. This is mainly due to a lack of trained teachers, lack of trained resources in the native language of the deaf, which is sign language.
The Early Childhood Programme focuses on two main areas. First, building the field of early childhood development, and second, supporting children and parents who face profound disruption or systematic discrimination, including refugees and migrants, children with disabilities and developmental delays, and those in the Roma or Gypsy community. The programme is currently active in Central and Eastern Europe, Central Asia, Southern and West Africa, Asia and the Middle East, with growing engagement in Latin America. Brief examples of our work include funding for an initiative called Big Belly Business in Liberia and West Africa, which promotes good nutrition and healthcare during pregnancy.
Along with the conference, an expo on early childhood development was also organized. The expo was the first of its kind in Pakistan, which featured early learning products, facilities, educational materials, both digital and printed, branding, and franchise services from different parts of the world. It brought a wide array of companies, manufacturers, distributors, suppliers, franchises, and service providers working on early childhood development on a common platform. It provided a perfect platform for building brand awareness, disseminating and exchanging information related to early childhood development products, trends, and facilities. The expo provided an opportunity for learning, interacting, and growing network and business products through exchanging ideas and sharing experiences. The concluding session of the two-day international conference was presided over by Professor Dr. Ziaul Qayyum, Vice-Chancellor of Allama Iqbal Open University, Islamabad, and Dr. Muhammad Azim Khan, Member Food Security and Climate Change, Planning Commission of Pakistan, as well as the Chair of ECD National Task Force. The session included the remarks by the dignitaries, presentation of the conference recommendations, and signing of a Memorandum of Understanding between Allama Iqbal Open University and Rupani Foundation, Pakistan, to establish a Center for Excellence for ECD.
This alliance, the ministry, the Allama Iqbal Open University, and the Rupani Foundation and some other colleagues, everybody make a make a movement, and everybody is complementing each other. Each corner of this country, in every part of this country, everybody starts speaking that early childhood development, early childhood education is the prerequisite for the good education system of Pakistan.
One of the most important things to take away is that children learn in an environment of relationships. And those relationships need to be nurturing, responsive, validating, inspiring, fun, loving. Look at our logo. I see hands not restricting, holding space, caring, protecting. I see a child that's allowed to dance, allowed to be free, allowed to be joyful within our protective hands. The Pakistan Alliance has done a tremendous job in pulling together the different ministries that have been working together, the different agencies, the different donor agencies, but this is the beginning.
So we had to create this alliance with the help of partners. We have created this Pakistan Alliance of Early Childhood. This is the initiative of Rupani Foundation. It was really, like everyone mentioned, has been very, very successful. We are here to serve the entire region, and inshallah, this alliance will serve the region. And Rupani Foundation's vision or the initiative is just not for Pakistan. We want to serve the entire region, and I want Pakistan to lead the entire region.
Rupani Foundation is not only focusing on Pakistan, also working for the region. Possibly from all these best practices, if we extract a relevant model for different regions of Pakistan.
The two-day international conference on ECD concluded with these recommendations. Legislate to recognize ECD from 0 to 5 years of age. Finalize the national policy framework which is in the process of development. Adopt a multi-sector and integrated approach for mainstreaming ECD in policy making, budgeting and implementation. Institutionalize for sustainability and scalability, political will for investing in the early years. Allocate adequate budget and finance for ECD, especially from 0 to 5 years of age. Develop knowledgeable workforce such as caregivers, ECD experts, researchers, ECD managers, and practitioners. Awareness for parents for early screening and referral services. Broaden data and evidence system through monitoring and evaluation. Create behavior change communication strategy and initiate advocacy. Target program delivery to specific population subgroups. Inclusive education for disadvantaged children and children with special needs. Parental education on the upbringing of children, both mothers and fathers. Build upon current practices and document the existing models and scale up the most effective ones.